If you're looking for top-tier surgical oncology care, you'll find it at Watson Clinic in Lakeland, and Watson Clinic is renowned for their patient care. And at Watson Clinic, they give hope to patients battling cancer. Good morning, Dr. Danny Barak. Thank you so much for joining us today. And Dr. Barak is a board-certified general surgeon and surgical oncologist.
Good morning. Happy to be here.
Thanks for being here.
Absolutely.
And we are talking about the sort of complexities that go into making these decisions and caring for a patient when they are diagnosed with cancer and surgery becomes an option or a necessity.
Correct. To start with, I think, just the word, when people hear it, cancer is such a scary word. Everyone doesn't want to hear it. In this field, I think, and especially at the Watson Clinic and in Lakeland, we're not saying, we do magic, but we have a group of, very, very well, established cancer care providers that, and we'll talk about it later, like in their multidisciplinary approach, that we do our best to really make patients comfortable and to really try to give them the best outcomes when they have this diagnosis. So that's kind of, our goal, and that's what we want to do at the clinic, is to really have, like you said, a very well-established, top-tier cancer care program, and that's kind of what we provide.
And what are some of the procedures and some of the different, I know you're using the latest procedures, latest technology and things to help care for these patients?
So cancer surgeries, or what we call surgical oncology, is kind of a subspecialty of the oncology, where we treat these very complex cases of tumors. We do a little bit of extra training on top of the general surgery that other surgeons do to really treat these complex surgeries. Everyone thinks of just, cancer, chemotherapy, radiation, and just bad outcomes. Unfortunately, that is the situation, but now it's just in the minority of cases. The majority of cases, we want to get them to surgery. We want to get that tumor out, and I think that's what really gives them what we refer to as survival benefit. That means they do very well and they live longer if they get to a point where someone can go in and safely remove the tumor. So that's the role of a surgical oncologist. And there's been a lot of advancements. We're always learning, we're always training. We always do extra, courses and things, because we want to stay on top of cancer care and those surgeries. And we've added a lot of these things in the region, at Watson Clinic, and also with teaming up with a lot of other specialists in the region. But mainly I want to focus on the idea of robotic surgery in the field of cancer.
Wow.
I always just give an example because, unfortunately it's common, the idea of rectal cancers. Before, it was very difficult to get to areas in the rectum because it's very difficult. The pelvis is narrow. Surgery there is very difficult, so people just used to only go and try to get chemotherapy or radiation. But surgery is still very, very important. And with the help of the robot now, we can do cases that were never an option before.
Because is there less probability of human error?
Correct. Well, that's one, but also, humans, we need to see and we need to operate
at the
and
same
sometimes
time.
Exactly, and sometimes, to get down and try to work in the pelvis in a very narrow area and remove the tumor safely, control the bleeding and all that. The hands can sometimes, with the tremor or with kind of wrong movements, we get in trouble. So by using the robotic instruments, they're fine movements, they parallel what we do on the console with a little bit of more dexterity and degrees of freedom, and the camera is high definition, so we always see better, and so that's why using that technology we're having better outcomes. So that's kind of what we're working on now.
And we want to clarify, it's not that the robots are taking our jobs, because it's still a human. The doctor has to control it.
I'm glad you mentioned that. I'm very glad you did, because even when patients come to me, I always do the same thing, and we were talking about this, earlier, that it's referred to robotic assisted surgery. I never tell the patient, we're doing a robotic colon resection.
Right.
We're doing a robotic assisted colon resection, because the robot has zero control. Like not 1%, not 2%. It's absolutely zero control. They just kind of translate our arm movements into some finer movements, but they cannot do anything without the operating surgeon. And I always tell the patients the same thing: safety comes first. At any point in the surgery, when we feel we're no longer in control, or we're not seeing well, or we encountered an issue, within, I would say, 30 seconds to less than a minute, I could be on the bedside doing the procedure without the robot.
You can step in. This is absolutely fascinating. Love the care that you're providing, Dr. Barak.
I appreciate it.
And again, there's the information. Of course, we didn't even get into the multidisciplinary approach, which love what you guys do with that as well. Thank you so much.
Absolutely. It's my pleasure. Thank you.